Here are some alternative treatment options for pleural mesothelioma that are being studied besides the standard multimodal therapy approach. Surgery. For early-stage localized mesothelioma, surgery may play a role as an alternative or addition to other treatments. Pleurectomy, decortication, PD. Surgery aims to remove the lining of the pleural cavity, mesothelium, and any tumors while leaving the lung intact. Extended PD removes more tissue including parts of the diaphragm and pericardium. These aggressive surgical procedures may provide better local tumor control and survival outcomes for some patients compared to standard chemotherapy or radiation alone. However, they also carry higher risks. Patient selection is critical and surgery is typically only recommended as part of a multimodality treatment plan for those with early-stage disease. High-dose vitamin C. Preliminary research has found that high-dose intravenous vitamin C therapy may help kill mesothelioma cancer cells. Vitamin C is thought to generate hydrogen peroxide that selectively targets and oxidizes tumor cells. It appears to be particularly effective against cancers like mesothelioma that are already sensitive to oxidative stress. Early phase 1 and 2 clinical trials are exploring vitamin C as a standalone and adjunctive treatment for mesothelioma. So far results have been promising without significant side effects. Larger phase 3 studies are still needed, but this offers promise as a potential non-toxic adjunctive treatment. Photodynamic therapy, PDT. PDT involves using a photosensitizing chemical agent, photosensitizer, that is given to the patient intravenously or applied topically as a cream. When activated by light of a specific wavelength, usually delivered via fiber optics, the photosensitizer produces reactive oxygen species that can kill cancer cells. For mesothelioma, researchers are studying using PDT to treat localized pleural or peritoneal tumors. It may help destroy any remaining cancer cells after surgery and has shown effectiveness in preliminary studies. PDT provides a targeted treatment approach with minimal side effects. Immunotherapy. Several immunotherapy agents that treat other cancer types by boosting the immune system's anti-tumor response are under investigation for mesothelioma, including checkpoint inhibitors, cancer vaccines, and adoptive T-cell therapies. Checkpoint inhibitors like anti-PD-1 drugs nivolumab and pembrolizumab help take the brakes off immune cells, allow them to better find and destroy cancerous mesothelioma cells. Early phase studies of these agents alone and in combination with other therapies have shown some efficacy in mesothelioma patients. Larger phase 3 trials are ongoing. Immunotherapies represent an important new realm of treatments that may improve outcomes either alone or combined with standard therapies. Targeted drug therapies. Researchers continue searching for targeted drug therapies that interfere with specific molecules and pathways driving mesothelioma growth and progression. Some agents already in clinical trials include antiphyllates like pemetrexed, angiogenesis inhibitors like bevacizumab, EGFR inhibitors like erlotinib, and multikinase inhibitors like nintedanib. Combining these targeted drugs with each other or with chemotherapy may lead to improved response rates versus single agents alone. Newer targeted drugs in preclinical testing focus on interfering with pathways like mTOR, IGF-1R, and hedgehog that seem particularly important for mesothelioma cell survival and proliferation. Gene therapy. Gene therapy aims to introduce new genetic material into patients' cells to fight the disease. For mesothelioma, researchers are exploring using engineered viruses to deliver tumor suppressor gene p53 directly into mesothelioma tumors. Restoring p53 function helps induce cancer cell death. Other avenues include silencing oncogenes driving mesothelioma like BAP1, delivering immunotherapy molecules like CAR T cells via viral vectors, and engineering mesothelioma tumor cells to express immune stimulants before reintroducing them to the patient. Although gene therapy for mesothelioma remains highly experimental, it offers the possibility of developing curative localized treatments alone or in combination with other therapies. While multimodality therapy combining surgery, chemotherapy and radiation remains the standard first-line treatment for pleural mesothelioma when possible, ongoing research continues exploring novel alternative and adjunctive treatment approaches with curative and palliative intent. Some promising alternatives in early clinical testing include aggressive surgery, high-dose vitamin C, photodynamic therapy, immunotherapy with checkpoint inhibitors and vaccines, targeted therapies interfering with mesothelioma growth pathways, and gene therapies. However, more research is still needed to determine their full potential as alternatives or additions to established multimodal care. The future treatment of mesothelioma will likely involve combinations of standard and newly developing therapies based on individual patient and